The FAST exam has four major windows. The first window of the FAST exam is Morison's pouch. With the indicator towards the patient's head, place the probe at about the 10th intercostal space. Slide the probe superior and inferior, and fan the probe anterior and posterior in order to see all the way through the interface of the liver and the kidney. The next window of the FAST exam is the subxiphoid view of the heart. Start at the liver and then use the liver as the window to visualize the heart. Start here at the liver and then slide all the way up into the subxiphoid notch. Ensure that the indicator is towards the patient's right and the cable exits the bottom of your hand. Fan the transducer and apply more pressure as the patient takes a deep breath. The heart should come down your screen. Here is the liver, here's the right ventricle, here's the left ventricle, here's the interventricular septum. The pericardium is traced around here. The next window of the FAST exam is the parasternal long window of the heart. Place the probe with the indicator towards the patient's left hip. Place the probe right on the sternum and then slide off until you see the long axis come down the screen. You've now obtained a long axis view of the heart with the indicator towards the patient's left hip. The next window of the FAST exam involves the splenorenal view. With the indicator towards the patient's head, position the transducer over the 10th intercostal space. Then, with the indicator towards the head, mid-axillary, slide superiorly and inferiorly to get the entire contents of the splenorenal window into view and fan anteriorly and posteriorly to get the optimal window. Recall that the stomach lies anterior to the spleen. So if you fan too far anteriorly, you're going to see stomach where the spleen should be. This is all stomach here. The spleen is at the top of the window. Now you may need to fan more posteriorly in order to get this stomach out of the view and to obtain this nice, crisp splenorenal view. And the final window of the FAST exam is the suprapubic window. This window is comprised of a transverse view with the indicator to the patient's right and then a sagittal view with the indicator to the patient's head. In the transverse view, fan all the way from side to side to obtain the complete window. Here we are fanning all the way through the bladder in a transverse view. Notice the bladder is a low attenuating structure, so structures posterior to it appear hyperechoic. Then, in the sagittal view, fan superior and inferior to obtain the entire window. The bladder is more triangular shaped in that sagittal view.